Welcome back. Well, the 2023 Women's Report has been launched today on Women's Day. It finds around 3.7 million girls in our schools are missing school, sometimes up to 5 days a month because of period poverty. In other words, they're not able to go to school because they don't have access to products like sanitary pads. At the moment, sanitary pads are zero rated for VAT. Some countries do make these free of charge for women and girls who can't afford them. There are some efforts to provide them for women and girls in our society. Dr Nishana Bhogul is a senior lecturer in entrepreneurship at the Stellenbosch Business School, also someone who contributed to this report. She joins us now. Dr Bhogul, good afternoon to you, and thank you very much indeed for your time this afternoon. What impact is period poverty having on female learners? It's clearly having a very big impact, a significant impact on their lives.
Good afternoon, Stephen, and thank you for having me. You're quite correct. Period poverty is having a significant impact on learners. On the one hand, they simply don't have access to products, and in the absence of safe and hygienic products, they're using rather undesirable alternatives, such as cow dung, newspaper, rags, leaves, and this type of use bears serious health-related risks for the users. Furthermore, in the absence of products that give a girl dignity, girls stay away from school. And as you might imagine, that this compromises their educational opportunities. The schools also often lack proper infrastructure. For example, in South Africa, there are 3,200 schools that still have pit latrines. They obviously lack then hand washing facilities and soap, and they also lack safe disposal facilities for the menstrual products. Many girls and women also lack accurate information relating to menstruation, which means that taboos and myths are perpetuated.
We've seen some women entrepreneurs, as I understand it, looking for products to help girls in this situation. Are there some available? And the thing about a sanitary pad, for example, is you can only use it once. Are there other products that maybe aren't single use?
Yes. So another popular product is a menstrual cup. And usually a medical grade silicone is used, and these products last up to 5 years. We also see reusable sanitary pads made from fabric that is with waterproofing layers and so on. So girls could use alternatives like that, reusable products to save them purchasing over and over again.
Are those quite expensive? I mean, are women and girls who aren't able to afford sanitary pads in a position to actually get these products, or are they being made available to them in some way?
Yeah, so this is where the entrepreneurs come in. They seek out donors who can provide pay for these products. So you have a case where the consumer and the customer are two separate entities, and this then allows girls to access products through the entrepreneurs. You also have the women now competing for government tenders to supply certain schools.
From the numbers that you've given us and from the numbers in this report, it's a large number of women and girls who aren't getting the help that they need. I mean, the help to give them proper dignity. I'm sure a lawyer could explain to us that it's a constitutional right. Why is there such a big gap?
So I think there's obviously challenges around implementation. So government policy says that schools in quintile 1 to 3 learners in schools, quintiles 1 to 3 should have access to free menstrual products. And we've seen cases where there have been mismanagement of funds, and also I think government is just struggling to get these things distributed. So that would be some of the challenges. You also have impoverished learners in quintile 4 and 5 schools. For example, you might have a bursary holder, and so that child would not have access to products.
With girls missing up to 5 days a month because of this, this means that just because of this one issue, it can affect the rest of their lives. It means that they don't get the right amount of education. It means that boys get ahead of them or get more education, let me put it like that. I mean, the impact is lifelong.
Absolutely. And it goes deeper than just missing the school, right? You bear the risk of having health-related things. You feel embarrassed and shame because you have misconceptions about menstruation. These are perpetuated by cultural taboos, cultural ostracization, where women and girls who are menstruating are not included in social activities. Dietary limitations are imposed on them, and so on. So far-reaching consequences.
Are there other measures our government should take? I mean, should this come under the Department of Basic Education in some way?
My belief is that if we go to the peak of the HIV/AIDS crisis, there were condoms available in just about every public facility. If you walked into a public restroom, there were condoms available. And similarly, products that are related to biological function, like menstrual products, should be available throughout, every public restroom. And there's no reason, even for privileged women and girls, to pay for products that support a biological process.
Dr Nishana Bhogul, thank you. A senior lecturer in entrepreneurship at Stellenbosch Business School and someone who contributed to the Women's Report, the 2023 Women's Report released today.